I'm going to be breaking down 15 most asked questions in your first trimester and the way to go about them with real talks, experience-backed advice, and hacks to make it easier for you. In this video, I'm going to be revealing hacks to make the first trimester much more easier for you. So you might want to stay tuned to the last 15 question because you wouldn't know the one that is bothering you. You might not know the number that will treat what is bothering you. So please watch to the end for you to know the right answer to that questions you're looking for, because I'm going to treat 15 good answers that you might be looking for. Hello, beautiful preggy. My name is Daisy Peter. I'm a mother of 3 beautiful children. I'm a content creator based in Port Harcourt. If you're just coming, welcome to my channel. All we do here is talk about healthy pregnancy tips, tips for your healthy baby, and how to navigate motherhood. If this is something you would like to be listening more often, please, I want you to hit the subscription bell, turn on your notification bell so that you'll be notified when more videos like this comes up. So let us get down to today's work, the main reason why we are here. 15 most asked questions about your first trimester and the best 15 answer you can ever get in anywhere. Let us dive in. And I'm going to divide this question and answer into 3 sections. So please make sure you stay through to the last session. The first section is the common symptoms that are in the first trimester, the most common questions asked in the symptoms of your first trimester. Section 2, we are going to be dealing with the medical and the emotional questions. While section 3, we are going to be dealing with the relationship and the mindset aspect of the first trimester. So number 1 question on my list on the common symptoms on your first trimester is it normal to feel exhausted in your first trimester? The answer is yes, it is very normal for you to feel exhausted in your first trimester. And the reason is because your body is building a placenta. Placenta is what connects you and your baby. It's through the placenta that your baby gets nutrients. So in this stage, your body is trying to build placenta. So in that process, you're likely to get exhausted. So in order to navigate through this, please have enough rest. Make sure you're always resting. Take your nap, take your siesta. Number 2 commonly asked question about the symptoms of your early pregnancy is, why am I so nauseous? Why are you always feeling sick and all that? Yes, it is very common for you to feel sick in your first 12 weeks of your pregnancy because your hormones in pregnancy are not very active, like your HCG hormones, and it is the HCG hormones that causes this morning sickness. So in order to reduce this nausea feeling, please take your ginger tea, eat in bits like small meals, and take your BC supplement. The number 3 question is, I am not feeling sick. I am pregnant, but why am I not feeling sick? Yes, it is very normal. I've always been sounding this in all my videos that all pregnancies are not the same. There are so many people that complain of spitting in pregnancy. Why somebody like me, I've never experienced spitting in my pregnancy. I don't spit. So it is very normal for you not to feel sick when you're pregnant. It is very normal. Different body, different structure, different behavior during pregnancy. So if you don't feel sick in your pregnant days, just thank your God because you are among the lucky ones. And these lucky ones are, let me say, 10%, or let me say 5% of pregnant women. They are under this category. So just count yourself to be among the lucky ones. But please, for any concern, still call your medical doctor. The number 4 question is spotting normal in your pregnancy? I talked about this too in the common question normally asked in your first trimester. I'll be dropping the video here, so you try to look at it when I talked much about spotting in pregnancy. Yes, spotting is very common in pregnancy, especially when it is very light, not a very heavy bleeding. But if it becomes heavier, please make sure you conduct or call your doctor. Then lastly, on the common symptoms in your early trimester, the last question, the number 5 question on this session is, what food can I eat when I'm pregnant? I will always advise that you eat healthy food. Please make sure you stay away from uncooked food. Make sure you stay away from alcohol, cigarettes, eat your leafy green, eat your leafy green, your vegetables. I'll be dropping another video here so that you can look at it to know the healthy food to eat while you're pregnant. So now that we are done with questions asked about the symptoms in your first trimester, let us now move over to the questions asked concerning your medical and emotional questions asked by some people. So please don't go away, because one of the questions here, or all the questions here, might be the answer to your worry. So let's go over to number one on the list on the emotional and medical questions normally asked by pregnant women. When should I start my antenatal visit? This is one of the questions that is normally asked by newly pregnant women. The answer is between 6 to 8 weeks of your pregnancy. Visit your doctor. You can call your doctor, or like me, I will always advise that the moment you find out that you're pregnant, no need to wait. Just call your doctor and start your prenatal visit, because early monitoring is very good. In case of anything, they can detect and they will start treating immediately. So the moment you confirm that you're pregnant, please call your doctor so that you can start your antenatal visit. The number seven question is, what prenatal vitamin do I need? One of the most common prenatal vitamin you need as a pregnant woman is your folic acid. It helps to build your baby's organ. It helps to develop your baby's organ. So skipping your folic acid may result to some defect in your baby's growth. So please endeavor to take your folic acid and also visit the hospital. Your doctor will prescribe more prenatal vitamins that are good for you. The number eight question is, why am I crying in my pregnancy? It is very normal. Me, I'm number one, I can cry. Mood swing is very normal in pregnancy because of hormones. Yes. So if you find yourself crying in pregnancy, do not get worried. It is very normal. So one of the ways to help yourself to navigate through this is, maybe you can talk to your therapist, you can talk to your husband, maybe you need one or little words of encouragement to talk you out of it. And please make sure you also engage in exercise. I've always been emphasizing on the importance of exercise. I will drop the video in my description box. You can look at it after this video. Yes, exercise can help you to navigate through this mood swing of crying in pregnancy. So if you see yourself always crying in pregnancy, nothing is wrong with you. You're normal. It is one of the signs and symptoms in your early pregnancy. Somebody like me, I can even cry from the beginning of my pregnancy to the end. Every little thing will just trigger me. I will just find myself crying. So if you're one of them, you've been crying in your pregnancy, just know that it is a normal symptoms. Number nine question is, how much weight will I gain? Yes, it is not static. It differs from different people, and even different pregnancy too. You can experience different amount of weight gain. But some people just gain between 1 to 4 pounds. But the most important thing is focus on eating a healthy food. Do not really focus on the weight you're gaining. Focus on eating healthy food. Then the number 10 question, which is the last on the medical and the emotional aspect of this question and answer session, is, can I partake in exercise? Yes, I've always said this, that exercise is very important in your pregnancy. There are some mild exercise that you can partake in your pregnancy. You have your yoga, you have your silent meditation, you have your swimming. All these mild exercises are very good for the development of your baby. It makes your baby to be energetic. You can also make your baby to be smart, and it makes you to heal faster after delivery. It makes your body to come back to its original form after delivery. So if you're someone that have always loved exercise, then you're pregnant and you're scared that, okay, because you're pregnant, you can no longer partake in exercise. No, there are still some simple exercise that you can partake as a pregnant mom. Then our last session of this question and answer is on lifestyle, relationship, and mindset. So that brings us to question number 11. Should I tell people that I'm pregnant? A lot of African mothers are sitting on this table. They like to make pregnancy a secret. When they are pregnant, they do not tell anyone, because maybe, especially people that are looking for children for years, they finally get pregnant. You want them to tell people so that they will buy their baby. No way. That's on a very lighter note, but on a serious note, I think this question is a personal question depending on your choice. So many people have reason why they tell people they are pregnant and why they don't tell people that they are pregnant. It's completely fine if you want to tell or you do not want to tell. But me, I would advise that you should still tell people that you believe that when things go wrong or when you're in emergency, they can quickly come for you. Tell people that you feel that maybe they won't tell to some other person that you wouldn't want them to know about the pregnancy. And of course, your doctor should be aware that you're pregnant so that they can monitor the whole process. Your doctor, your husband, or whoever that is in charge of the process should be aware that you're pregnant. Number 12 question is it safe to travel during the first trimester? Yes, it is very safe to travel during the first trimester, but make sure that in the traveling process, you're not put under pressure. Please enter vehicle that is good. They will not the one that will be stopping on the road. And please make sure to ply roads that are not bad. Ply roads that are very good. The road that will not make you to feel discomforting. The only time I will advise you not to travel again in your pregnancy is when you're in your last trimester. Let me say around 37, 38 weeks of your pregnancy. It is no longer advisable for you to move long distance because labor can start anytime and you wouldn't want to entertain any form of emergency. So during your last trimester, please don't travel anymore. Just stay around areas that you registered for your antenatal. Number 13 question that people normally ask is, how can I deal with the fear of miscarriage? I understand you. It is very normal. It is totally normal for you to be scared or to be afraid of losing your baby, especially first time mothers or those people that have been looking. Everybody in particular, self, there's nobody that will have a baby inside of them. At the end of the day, the baby will be out because of one reason or the other. So I will only tell you that you do the best that you can do. Put everything in God's hand. Just pray and do the ones within your power and leave the rest for God. And I assure you and also pray that God who started the journey, God who put the baby there will not let you to have any miscarriage. Always speak positive things. Avoid listening to bad news. Avoid listening to bad things that will trigger you or make you be scared. So just have a positive mindset that this baby is here to stay and you give birth to your baby alive. So the number 14th question that people normally ask is, now that I know that I'm pregnant, what should I start planning now? Okay, my answer is what you should start planning once you discover that you're pregnant is the hospital you go for your antenatal. You start planning for the kind of clothes you buy for your baby. Develop a positive mindset. Tell yourself that you're going to give birth successfully. And that's basically all of it. There is not too much thing to plan, just the financial aspect of catering for your baby because it is not easy to cater for a newborn. So the financial aspect, the emotional aspect and everything is something that you really need to work on. If you're not really financially buoyant enough, the moment you know you're pregnant, start preparing for your delivery list. Start buying things little by little so that before the ninth month you buy everything. Then the hospital bill too is something that you should start working on so that that day to not turn like the hospital is a bad hospital or wicked hospital when you're not able to pay your bills and they say you're not going. So the moment you're pregnant, start planning financially on how to navigate through the pregnancy. And the number 15 question, which is the last on my list for today, is, what is that thing that every mother, every pregnant woman is expected to be hearing during pregnancy? Everything you need to be hearing during pregnancy should just be support, encouragement. You can do it. Please stay away from all negative talk. Stay away from every negative advice. Whatever thing that will put you under pressure or under fear, stay away from it. Always stay around positive people, people with positive mindset, people that will give you all the encouragement and all the support that you need. So these are basically the 15 questions that I can remember for now, ranging from the common symptoms, question from your lifestyle, relationship and mindset, and then from your medical and your emotional mindset. Please, if there is any question that is bothering you, you want me to talk about, you can say them in the comment section. Then in my next video, I'm going to treat them. If you've watched to this extent, it means that you found value in what you just saw. Please, I want you to like, comment and share this video so that it gets to other pregnant women who are also there with some questions they are raising that no one has ever given them the answer to the answer to treat them. Who knows, this video might be of help to them. And please, mind you, I want to also remind you that I'm not a medical doctor. All my teachings here are based on personal life experience and on research. Thank you for watching. Bye, and see you in my next one.